Hello, my name is Kayla Scappaticcio, and for this skills video, I'll be demonstrating the correct sites to give an intramuscular and subcutaneous injection. I will also be demonstrating the correct way to give those injections. Upon entering the room, I will knock, introduce myself, follow my general principles and safety practices, sanitize my hands, follow my 11 rights, 3 checks, 2 patient identifiers, and check my information against the EMAR. To find the correct intramuscular sites, which would be the deltoid, the vastus lateralis, and the ventral gluteal. To find the correct site for the intramuscular injection, I would find my acromion process, go 3 finger breaths down, create an upside down triangle, and in the thickest part of the deltoid muscle is where I would give my injection. For the vastus lateralis, I will section my outer thigh into thirds, horizontally and vertically, and in the outer middle third is where I would give my injection. For my ventral gluteal, I will put the palm of my hand on the greater trochanter, making sure that my thumb is pointed forward. My pointer finger is up at the anterior superior iliac spine, and my middle finger is rotated back to my iliac crest. And in the middle of that triangle is where I will give my injection. For my subcutaneous, there are 5 location sites. I could give my subcutaneous on the upper part of the back near the scapular area, on the lower part of the upper ventral gluteal area, and in the upper part of the arm in the fatty area. I can also give a subcutaneous in the anterior thigh and the abdominal area, avoiding the umbilical area between the costal margin and the iliac crest. And that is where I would give my subcutaneous injection. I will be demonstrating how to give my subcutaneous and intramuscular injection. For an intramuscular, I will give it in the deltoid, and for the subcutaneous, I will give it in the abdominal area. I would check my correct medication against the EMAR. I would use my general principles and safety practices. I would assess my sites for any abnormalities, ensuring not to give an injection in a scar, in a tattoo, making sure that my subcutaneous sites are located. This would be for a glucose and influenza vaccine, the influenza going in the intramuscular, so I would make sure that my patient is not allergic to eggs. I would check vital signs. I would check my patient's glucose for an abdominal subcutaneous injection. I would give the correct information to my patient, such as purpose and action of the medication and what signs to look for any side effects. To give a proper deltoid injection, I would sanitize my hands, don my gloves. For this injection, it is usually given with a 20 to 25 gauge syringe and a 5/8 to 1.5 inch needle. Before injecting the needle, I will cleanse my vial, pull off the cap, draw up the correct amount of air for the amount of medication that I'm going to administer. Inject air into the vial. Pull up the correct amount of medication, making sure there's no air bubbles in the syringe. I would never recap my needle. I would scoop the needle into the cap on the table for correct transportation of the medication, the needle, and the syringe. When giving a deltoid injection, this is usually given at a 90-degree angle. I will cleanse the patient's arm where the deltoid muscle is from the inner to outer area. If I would use the Z-track method, I would pull the skin to the left, inject my needle at a 90-degree angle, let go of the skin, inject my medication slowly, pull back the needle, pull out of the arm at a 90-degree angle, engage my safety, and put my needle in the sharps container. I would then wipe with a gauze and apply a Band-Aid. I would monitor my patient for 10 to 15 minutes for any adverse reactions. To give a subcutaneous injection, this would be in the abdominal area. This is usually given with a 25 to 30 gauge syringe and a 3/8 to 1 inch syringe, needle. I would check my medication against the EMAR. Cleanse the vial. Remove my cap. Draw up the correct amount of air for the amount of medication that's going to be given. Inject the air into the vial. Pull up my medication, ensuring that there is no bubbles in the syringe. I would not recap my needle. I would scoop the cap up that is laying on the table for the correct transportation of the medication and the needle to the patient's room. For giving the subcutaneous injection, I will cleanse the abdominal site from the inner to the outer. This is given at a 45 to 90-degree angle, depending on the amount of subcutaneous fat. For this video, I'll be giving it a 45-degree angle. I will pinch the skin, inject the needle at a 45-degree angle, inject the medication slowly, and pull out at a 45-degree angle. Before injecting the needle, I will let go of the skin. I will dispose of my needle in the sharps container. I will wipe with a gauze, ensuring not to massage the area, and apply a Band-Aid. I will also monitor my patient for 10 to 15 minutes for any adverse reactions. I would let both of those sites that I cleansed before giving the injection, I would let them air dry. I would not fan them or blow them. After giving my medication, I will note the correct time and date, the correct medication, and the correct site. I will remove my gloves, wash my hands, report and document.